Blood pressure is one of the important vital signs. The temperature, the pulse, the respiration, and blood pressure. All these are very important vitals. A low pressure as well as a high blood pressure, both are real problems. There must be a balance. And taking a blood pressure is an art because it is not just attaching some wires with a patient and connecting the wires with an instrument or equipment in which something is recorded, like an ECG. This is not like that. Patient, the doctor or the nurse, or the instrument. Anywhere, errors can happen. And there are a lot of things to be considered, a lot of conditions to be fulfilled before we start taking a blood pressure. That means errors are very common in taking blood pressure. Many of the errors can be avoided if we take some precautions before taking a blood pressure. I would like to talk something about what are the factors which can affect taking the blood pressure and what factors can give you a wrong result and how to avoid that. Before going into that, there is one thing, nobody's fault. It's not the patient's fault, it's not the apparatus fault, and it's not the doctor or nurse's fault. There is one condition which is seen in 1 in 5 people, not a disease, but a simple problem. What is that? We call it white coat effect or white coat hypertension or white coat syndrome. All are same. White coat. Why that name? This white coat effect is named because the person who is taking a blood pressure usually wears a white coat. We'll see what actually the white coat effect is. Is it the patient's problem? Is the problem is with the defective instrument? Or is it a problem with the doctor or no? It is nobody's fault. So what is this white coat effect or white coat hypertension factor? It is something concerned with the psychological aspect of the patient. The person who comes to the hospital, he'll be a bit anxious. His anxiety and the hospital settings, sitting in front of everyone, an unknown doctor who is going to take a blood pressure, and all this can increase his anxiety. If a reading is taken in this person who is very anxious, it may show an increased reading. And if the same person, if he goes home and if he has his blood pressure taken, he may have a normal blood pressure there. What will be the difference actually? It may be around 10 millimeters above the normal reading for that particular person. If the reading shows in a hospital setting or in a clinic setting around 130 or 90 or something like that, his blood pressure may be 120 or 80 millimeter of mercury at home. Why this? Just because the person is very anxious, a nervous person, and who feels that his blood pressure may be high, and all this feeling itself can increase his anxiety. When a person is anxious, what really happens? His pulse rate goes up, and the blood which is pumped out by the heart will increase. More blood comes out. That itself will increase the blood pressure. The heart rate or the pulse rate increases. So the heart, instead of beating 70 times, it beats about 80 to 90 times. Now this also will increase the cardiac output and they will have a more BP. Once he goes home, he is relieved of the tension, the stress, the anxiety, everything goes naturally. His pulse rate comes down, his BP also comes down. Is it a simple phenomena? Of course, people have been thinking that it's a very simple phenomena. After all, he is anxious. it may show a high reading and all. The first thing is how to know whether he is really anxious or the increased reading is due to his anxiety. How to know this procedure? In the sense, when a person comes, I used to count his pulse rate. If the pulse rate is 70 to 80, I will take it as a normal pulse rate for that person. And when I feel a pulse, I can feel the volume by feeling the pulse, a bounding volume. If the pulse comes with a bounce, a bounding pulse, then I can easily feel that the person is anxious. One. Second thing, the by look itself we can identify the person is anxious. He may have palpitation, mild tremor may be there, even mild sweating may be there. All these things are signs of anxiety. How to avoid this? Number one, make him comfortable. Talk to him. Divert his mind. Ask some general questions. And slowly he will feel comfortable in your company. Within a matter of minutes, his anxiety will subside. During this time, you can just count his pulse rate. At the first instance, if his pulse rate was 100, now slowly after 5 or 10 minutes, his pulse rate will be around 70 to 80. This is one method. Second is you take a reading, count the pulse for 1 minute and record it in a paper. And ask the person to relax and sit outside. And after giving a 5 to 10 minutes rest, again bring him here and check his pulse. Now you would have got a bit relaxation and definitely there will be some change. Now you take the reading. And even when you take the reading, don't take one reading. I used to take minimum 3 readings in one hand and we check on both hands 6 readings. Even if one reading or 2 readings shows a normal reading, we can definitely conclude that this may be due to this effect, the white coat effect. If you are not convinced, the only way we can have this is you can have a what is called ambulatory pressure monitor. A device is there which is attached to the person. He can wear this, and that device will monitor his blood pressure 24 hours. We can simply see what happens during the daytime, nighttime. So this ups and downs of the blood pressure can be recorded. This is one way of doing this, but many people are not very comfortable of wearing this and all. Now, the next thing is it dangerous to have this sort of white coat effect? Previously, doctors felt that it is just a simple thing. After all, a person is anxious, definitely his BP will be high. But thing is, even for a simple thing, taking a blood pressure, if he becomes very anxious and if his blood pressure shoots up, in a day when he is outside, how many times he will become anxious? And every time when he becomes anxious outside, or stressed or tensed outside, definitely his blood pressure will go up. The second point is to come back to normal, how much time it takes, we don't know. A person who is stressed or tensed or anxious, within 5 minutes, some people may back to normal. But some people, that state of anxiety may continue for an hour or two sometimes. So in a day, a person gets 5 or 6 times like this, then that is also a problem for that person. Second thing, researchers have proved that these people who have this white coat effect will have a continuous rise in blood pressure in future. The possibility of getting a heart problem in these people is more. Now, the present situation is better to treat these people. People used to come to me and tell me, Sir, I'm getting often angry. Is it because of blood pressure? Please check my pressure. A high blood pressure will not cause this type of anger and all. Because of this frequent angry mood, this person may get BP. So it is not the BP which causes anger, but it is the anger which increases his BP. So it's a mood. Always anxious people, anxiety disorder people. A blood pressure which is increased due to anxiety. The first thing we should do is reduce his anxiety either by medicine or by other things like meditation, etc. We can treat him we can reduce this anxiety. The pressure which is increased due to anxiety will come down. Or you can do one thing. If you have a medicine which can reduce anxiety as well as the increased blood pressure, that will be okay. Yes, we have some medicines which will reduce the anxiety as well as which will reduce the blood pressure. So that will be a good treatment for these people. Apart from this, what can be done for these people? To treat them or not, it's a big question. If you give an antihypertensive, a drug for this type of people, the next day when they go home, when they become normal, when they are not anxious, they may go for a low BP or hypotension. That is also dangerous for these people. So we have to take a good decision how to treat these people, how to approach these people. And before that, we have to confirm whether the rise in BP is due to a sustained blood pressure, which should be treated as a disease or disorder, or is it a momentary increase due to the hospital setup. But even then, we can ask them to go for exercise, good diet, stoppage of smoking, stopping of alcohol. All these lifestyle modifications we can advise them, and we can ask them to come back after some time, after 2 to 3 visits. If the doctor is very friendly, most of the people will have a normal BP. And if you see the readings of the blood pressure, two numbers, the upper number 120, the lower number 80. Usually when a person exercises or stressed or anxious, the first number 120 used to get increased. That is the systolic pressure. So if a person's pulse rate is more, if the systolic pressure alone is raised, it may be due to anxiety, something like an exercise. So this is about the white coat effect. To treat it or not depends. The best thing is, instead of giving medicines, some modifications will try for some time and conclude that it is only because of the white coat effect. There is another type of problem, opposite, what is called masked hypertension. Masked hypertension means when they come to the hospital, when a doctor takes a blood pressure may be normal. But when he goes out, especially to his office, this pressure may be high. That is because of the stress, the atmosphere, the environment, the working atmosphere. That may cause an increased blood pressure for these people at office or at home sometimes even because overthinking, overstress, domestic problems, all these can cause an increased blood pressure. But once they come out of the situation, especially to a hospital, they get relieved. At that time, they may have a normal blood pressure, but when they go out and start working, they may get increased blood pressure. This is called masked hypertension. So I think I have given some explanation and what is this white coat effect, white coat hypertension, or white coat syndrome. This is a physiological variation of blood pressure, an increase due to stress, anxiety. This cannot be treated as a disease or a disorder, but in long term, they may get problem. So we have to balance how much to treat, how long to treat, how to monitor, how to follow these people. And people who have this white coat effect should be followed, monitored for some time to know whether they are going to get a real, sustained, continuous increase in pressure. This is one, I cannot say this is an error. This is nobody's error. It's not the instrument error. It's not the doctor's mistake or it's not the person's mistake. I can say it's a physiological phenomenon. I really wanted to tell the factors and conditions to be fulfilled. And what are the factors which can give a wrong reading? I just want to discuss about that. But before that, this is one of the conditions in which, for nobody's fault, you will get a wrong reading. In my next video, we'll talk something about the factors which can affect blood pressure reading. What are the checkpoints we should check before taking a blood pressure? Till then, bye. Thank you.